Okay, so good morning, everyone. My name is Carey, and I'm a second-year graduate student at the University of Arkansas for Medical Sciences. And my presentation today is focused on hemozoin as a bio-inspired nanocrystal with high-contrast photoacoustic signals for ultrasensitive malaria diagnosis. Now, just to start off with my background, so I'm actually from the Bahamas, and I ended up in Arkansas for schooling. And for those of you who don't know, the Bahamas is a small island nation. We actually have about 7,000 islands, and a lot of people tend to get us confused, but just so you guys know, we are not a part of the US, and we are also not a part of Jamaica. Now, out of all these islands, I grew up right here on this tiny one here. We have a population of about 3,000 people, and we're known for some of the most beautiful beaches in the world, as well as our swimming pigs. Okay, so just to start off, the whole idea of photoacoustic flow cytometry, especially with our use in our lab, is for in vivo applications. So we use a laser, or we use several lasers of varying wavelengths, and we focus them into the blood vessels of our animal models, most especially in the ear of our nude mouse models because they lack melanin, and so it's very good for creating standards. We get perfect signals from our nude mouse models. Above the ear, we have photodetectors where we can acquire fluorescent signals from any fluorescently labeled cells that may be in circulation, such as fluorescently labeled metastatic cancer cells. And also we have a transducer which acquires acoustic signals from these particles. Now, just to explain a little bit more of the whole idea, I'll use hemozoin as an example. So hemozoin is a byproduct of the malaria parasite. The malaria parasite infects the red blood cells, consumes the hemoglobin, and excretes alpha-hemotin, which then converts it into beta-hemotin, which is an inert crystal. These crystals are highly optically active, and they absorb lots of energy from the laser light that we send into the skin. It creates a thermal expansion, and this expansion forms a small acoustic wave that we're able to detect by the ultrasound transducers we place near the skin. And so any tagged cells that are in flow or are infected red blood cells, we're able to detect them in real time as they cross the point of detection with our laser. In my study, we used GFP expressing malaria parasites as a confirmation that the photoacoustic signals that we were receiving were in fact coming from these infected red blood cells. Here is just an example of some photospectric data of a lot of the material that we kind of use in our lab. So here we have the absorption spectra of hemozoin, and here we have oxygenated and deoxygenated blood. For the preliminary studies that I did, I used 671 nanometer wavelength laser because it had a really large contrast between absorption of the hemozoin crystal and the absorption of hemoglobin in the red blood cells. However, later on in my studies, I began to conduct some more experiments to make it more clinically relevant, as 671 doesn't really pass that well through skin. And so for real-world applications, we would need a laser that's more in the window, in the tissue window. So I also did some work with 1060 right here. The signals received from our 1060 laser were not as clear and defined as those received from 671. However, I'll show you later on in this presentation that we do still require some interesting data. Oh, also, I heard there are some people that worked with melanoma here in the room. Our lab also uses the same technology. We've done some preliminary clinical trial work, and we also have a mouse model where we've detected metastatic melanoma cells in flow using similar technology because the melanin crystals in these cells give a similar photoacoustic peak as to those of the infected hemozoin-containing red blood cells. Just some benefits of photoacoustic flow cytometry that we really focus on is the fact that it gives us access to a larger volume of blood. In the clinics, whenever we're trying to get blood drawn for diagnosis of a particular disease and you're in search of biomarkers, they'll take a few mils of blood here and there. But there's always a possibility that if biomarkers are present, the concentrations may be so low that the amount of blood that you take from this sample may be insufficient for you to gain a proper reading. So with this, if you have your patient sitting and you're focusing the laser into the blood vessel, as the blood flows through this blood vessel, you have access to larger volumes of blood. Depending on the size of the blood vessel, and thus far I've worked with blood vessels as large as about 2 millimeters in diameter. Millimeters up to liters of blood can pass through within half an hour to an hour in a human patient. Also, with this method, it's completely non-invasive. There's no need for injection of any nanoparticles. In the cases that I'm working with, which is the melanoma and hemozoin, no injections required and no drawing of blood. And it could potentially require less technical ability. And what I mean by that is currently in malaria-infested nations, one of the best ways to diagnose the disease is by highly trained microscopists in this area that take a lot of time to be able to give a correct diagnosis of the disease in the early stages, because the parasites can sometimes be difficult to see and they don't have access to these trained specialists. And also the flexibility, like I've explained. We have applied this data to many different things, and we're always open to trying more approaches. So just a little more background on malaria. There's an estimated of 198 million cases per year, and these cases are most predominantly in the tropical areas of sub-Saharan Africa and the Amazon, and about 584,000 deaths, with the majority of these being in young children who have weaker immune systems and are unable to properly fight this infection. Like I said, proper diagnosis usually require trained microscopists. Now, they do have the rapid diagnostic test of malaria, but a lot of the areas afflicted with this disease just simply don't have the technology for that. And our hope is that we can eventually reduce the size of our system to something that's a lot easier and something that's a lot automated, that would reduce the cost and the training necessary to actually be used, and that they can be implemented more into the clinics. Here I have some bright field and fluorescent microscopic images of some samples that I took from my malaria-infected mice during the different stages. So if you see here, this dark spot, I don't know if you guys can see it, but this is an example of the hemozoin crystals that can be found in the more mature stages of the parasite. And as I said, we had the parasites fluorescently labeled as a confirmation, but that's what we were receiving. Now, also in our laboratory, we have a photoacoustic microscopic setup where we can scan our samples with the laser, and by the same principles of thermal expansion, we can receive these images here. So these were received with two different wavelengths of light, 532 and 671 nanometers. And here is a three-dimensional image of a sample. So the infected cells give a higher photoacoustic peak as compared to those uninfected cells right here. So this slide is simply to show a comparison of what we receive in our photoacoustic traces. So the traces move across in time, and we get peaks as these high contrast agents cross the detection point in flow. These are some of my fluorescent images. And as you can see, as the parasitemia increases, as shown by the fluorescent staining, we also have a similar increase in the parasitemia as shown by what we receive with our PA flow cytometry system. Okay. next. So right here, these traces were all taken within a 1-minute time point. This image here is basically showing the differences in our mouse model setup and what we hope to continue to develop into our clinical setup. So with the superficial vessels that are found in the mouse ear, they're rather small. They're about 50 to 70 microns and about, I'd say, 100 microns in depth from the surface of the skin. So we can focus a laser down into the ear and receive a photoacoustic signal rather easily. We use a focused laser and an unfocused transducer to receive these signals. However, due to just simple diffraction of light and loss of energy as you go deeper into the skin, the method that we use to access deeper vessels here is to use an unfocused laser beam that actually can access a larger volume of the blood. The energy fluence is still sufficient to receive a photoacoustic signal from the particles, but how we're able to increase the sensitivity is by instead using a focused transducer and focusing that transducer into the central point of the vessel here. And that's how we're able to get the signals. So these are a comparison of those traces. Here, the shallow traces are fewer because we have a smaller volume of blood passing through the smaller vessel in the same amount of time. However, due to the lesser amount of skin above the vessel, these peaks tend to be a lot clearer and higher, or the background tends to be lower, I should say. So we get a lot less background. This here, oh, darn, that's actually the wrong image, but what I wanted to show is that the data that we receive from here, we receive a lot more. So these two images are just, these were taken on different days of the infection. So this was earlier on in the infection, and this was near the peak of the infection where we have a lot more infected cells. This is about 50% parasitemia here. But in our larger vessels, if it were on the same day, it would look similar to this in that we have a lot more peaks. However, the background would be a lot larger and the peaks would be slightly less. Okay, so here what I have are, I was able to follow through the infection from the first day of infection in our mouse model up until we were unable to see any more fluorescent signals in the blood. So that's what we determined to be the point that the immune system had actually cleared the infection out. So here I have it with my 671 laser, which was in the ear model, and the 1060 laser. This was taken in the carotid artery and jugular vein. And this also shows a comparison of how strong the photoacoustic signals in our readings are when they're coming from either an artery or a vein. So we see that the time course of the infection followed pretty much the same, whether it's in a shallow or a deep vessel. But we also see that in our arteries, we tend to get a lot more signals than what's found in the vein. And that could be attributed to the higher velocity of the artery simply pushing through more of the infected cells in a detection point within a particular amount of time. It could also be the differences in the absorption of the oxygenated and deoxygenated hemoglobin at that point, which gives different differences in contrast between the hemozoin and the red blood cells. And so we may just be simply missing some of the infected cells due to the difference in the absorption here. And I think, yeah. So that's all I have to show right now. These are all of the members of my lab. My advisor, Dr. Vladimir Zarov, everyone else that we work with, all of the research assistants, and then we have Jackie and Walter who are here with me today. And that's it. So any questions?